Hello, my name is Alma Robinson, and I am the Executive Director of California Lawyers for the Arts. CLA is a statewide nonprofit organization that was founded in 1974 to serve artists and arts organizations of all disciplines with advocacy as well as services that provide support with legal and business issues. With staffed offices in San Francisco, Berkeley, Sacramento, Los Angeles, and San Diego, we provide several core services. First, we provide legal counseling to specialized attorneys who provide assistance with a variety of intellectual property questions, as well as contract reviews and negotiations, and other important business issues. Depending on the client's financial status, legal assistance may be available on a pro bono or reduced fee basis. We also provide a specialized program that assists independent inventors and small startups with their patent applications. To help with situations involving disputes, we provide a range of alternative services, including negotiations counseling, mediation, and arbitration that can avoid the expense and hassle of going to court. Finally, we offer a full menu of educational programs that include workshops, symposia, and conferences on various legal topics for artists and arts organizations. Many of these programs are posted on our YouTube channel, and we encourage you to use these tools to educate yourself on the legal issues before you reach out for specialized assistance from our organization. Thank you for joining today's program, and please consider joining CLA on our website at www.calawyersforthearts.org so that we can continue to maintain our full range of services. Thank you.
So I'm very happy to be here today. The presentation itself will be pretty short and to the point, and then any questions I'm happy to answer. All right, so I'm with the Entertainment Health Insurance Solutions. We are based in Southern California. We do have other services available throughout the country through our sister program, which is AHRQ, Artist Health Insurance Resource Center. I like to start out the presentation discussing some terms that you'll want to know throughout this presentation. I'm going to go ahead and skip this particular page, but the next page is important. So some terms that you should know when thinking about insurance is what type of insurance plan you're going to get. A lot of people know what a PPO is. That's a preferred provider organization. That means that for the most part, you will have in-network benefits, which means that the doctor is contracted with your plan, and you will have some level of coverage when you go out of network. Another plan that people know a lot about is the HMO, or Health Maintenance Organization. That means that you are with a primary care doctor who is part of a specific medical group, and that doctor is your gatekeeper and in charge of referrals to any other types of doctors that you may need, and you have to stay within that medical group. One that some people don't know about that is somewhat unique to the individual market is EPO, also known as Exclusive Provider Organization. It's kind of like a hybrid between an HMO and a PPO. You can go to any doctor of your choice without any referrals. However, you will need to stay within the EPO network. You cannot go outside the network. There will not be any coverage. Another term that you should know is subsidy. The subsidy is the premium assistance that you would receive from either the federal government or now the state of California. The Affordable Care Act. The Affordable Care Act passed March 23rd, 2010. It offered a number of benefits. These are the ones that people are most concerned about. One of them is that there's guaranteed issue. You cannot be denied because of a pre-existing condition. They offered standardized benefits across plans, and we will get into what a standardized benefit is. Rates are no longer based on your health status. Prior to the Affordable Care Act, in the private individual market, there would be 5 tiers that you could be rated. 1 was the best price, and 5 was about 500% the best price. There are no more lifetime limits on your benefits. Prior to the Affordable Care Act, plans usually had either a $1 to $7 million cap Those caps are no longer there. You cannot be canceled. That's a tricky one, and it's not 100% accurate. You cannot be canceled because you become sick. However, if you don't pay your premium, or if you're eligible for Medi-Cal and you don't comply with a request for information, you can be canceled, and they will cancel you. Young adults can stay on their parents' coverage until age 26, and preventive care services are covered 100%. Part of the Affordable Care Act was the expansion of Medi-Cal, or Medicaid in other states. This allowed childless adults to become eligible under the California Medicaid program. It is for people whose income falls below 138% of the federal poverty level. And we'll go over what those levels are. Eligibility is based on your income and household size. And it's not just medical, so you also get dental and vision included. For individual and families that don't have employer coverage, you have certain periods of time that you are eligible to enroll in a plan. Right now is open enrollment, and it begins where you can start making changes or applying November 1st, and it's through December 15th of every year, and that is for a January 1st effective date. In the state of California, it's always been extended. It is almost always through the month of January and sometimes through part of February. Some qualifying events that allow you to enroll outside of open enrollment would be getting married, having a child, an overage dependent losing coverage because they're aging off of their parents' policy, losing health coverage through an employer or a divorce, or your COBRA has ended, moving outside of your service area. So let's say you move from Northern California to Southern California, that would give you a qualifying event. And becoming eligible or losing eligibility for Medi-Cal. Those are only a few of the eligibility options that allow you to enroll outside of open enrollment. There's a million different ones, and they keep adding to them. So if you think that you can qualify, then you should reach out and contact somebody. And most likely there will be some reason that you would be eligible outside of open enrollment. If you do have a qualifying event, you technically have 60 days from the qualifying event to find a new plan through the open market. How Covered California determines your premium and cost sharing reductions. What Covered California does is they look at a number of things. They look at the number of people in your household. And when I say that, I don't mean if you live with a roommate, you don't count that person. I'm talking about the number of people that you have on your taxes. They look at your household income, and they're looking for your modified adjusted gross income. They are also looking at your permanent zip code, as well as the age of each person enrolling. This is the most current federal poverty level chart. And this is how you would determine where your eligibility would fall as far as getting premium assistance. Premium assistance is from 138% to 400% of the federal poverty level for federal premium assistance. And as of the beginning of 2020, California has added money to help people that fall between 400% and 600% of the federal poverty level. Earlier on, I mentioned that one of the provisions in the Affordable Care Act was the standardized benefits. This is what a standardized benefit chart looks like. It means that every bronze plan with every insurance carrier will look the same in design. So if it's a bronze plan, the benefits will look identical, whether you purchase the bronze plan through Blue Shield or HealthNet or Molina or Kaiser. The benefits are standard across the board, and that's to make it easy for people to understand exactly what kind of health insurance they're receiving. This form is the 2021 patient-centered design. And when you're looking at this form, the plan names are across the top, and shaded in blue are benefits that you receive prior to needing to meet any kind of deductible. So you'll notice the bronze plan is the most limited as far as benefits before needing to meet a deductible. And then the silvers are better. And then there's gold and platinum, which have no deductibles. Within the silvers, you will see that there are these enhanced silver plans. These are people who fall between 138% of the federal poverty level to 250% of the federal poverty level. They would be eligible for these silver levels, depending on where they are. Some differences that are available when you enroll direct through the carrier versus enrolling through Covered California. If you are eligible for premium assistance, the only way that you can receive that premium assistance is if you enroll through Covered California. If you do not get premium assistance, if you're not eligible because your income is too high, then you would want to definitely go direct to the carrier for your insurance. The reason that you would want to do that is for a couple of reasons. One, when you go direct to the carrier, there are more options than just the straight bronze through platinum plans that I just showed you. And for another reason, in 2017, the federal government stopped funding the cost sharing reductions that are in the enhanced silver plans. And the way that the state of California was able to continue to offer those plans with the cost reductions in copays was to raise the regular silver plan premium. So the silver plan, the silver 70 on Covered California is going to be more expensive, but no different than a silver 70 sold direct with a carrier. It'll be anywhere from 10 to 20% more in premium. So that's another reason why if you don't qualify for premium assistance, don't go through Covered California. The other reason why someone wouldn't want to is if they don't want to provide their income information to the state or federal government, then they wouldn't want to enroll through Covered California. So payments and penalties. Payments are always due by the first of the month. When you first get enrolled in a plan, you want to make sure that your premium for that new plan is paid by the first of that month. And then once you are enrolled, you begin to get 30-day grace periods. As far as penalties are concerned, federal penalties no longer exist. However, due to the fact that California has instituted some additional subsidies, in order to cover those subsidies, they have made it a mandate that Californians have health insurance. And there is now a penalty for Californians not to have health insurance. And that is effective January 1 of 2020. And the penalties follow the penalties that were part of the federal provisions. And it's about $695 a year or per adult, or 2.5% of your income, whichever is greater. Some quick facts to know, because providers are still giving this wrong information, is that Covered California is not an insurance company. So if you have a provider that tells you they do not take Covered California, you can tell them they're right. They don't, because nobody does. They take a private insurance plan, and Covered California houses those plans. So if someone that you've spoken to that has helped you find a plan has researched and found your doctor as contracting with the plan that you've selected, and they choose to not take you at that doctor's office, they really can't do that. And you need to contact the insurance company right away. I have personally helped a lot of doctors' offices lose their contracts with insurance companies for discriminating against people that purchase through Covered California. So if you would like help with that ever, I'm more than happy to assist. And please remember to check two things when you're checking on a new plan. One is the drug formulary, because drug formularies, although every formulary must have a drug in every therapeutic category, they do not need to carry every drug in the therapeutic category. So it's important that if you're on expensive medications or life-saving medications, that you make sure that the formulary that is part of the plan that you are selecting is going to cover your medications. And finally, it is super important that if you have income changes because you are freelance or because of the type of work that you do throughout the year, it is very important that you notify Covered California within 30 days of that income change. I have clients that reach out to me monthly because their income has changed from what they thought it was going to be in the beginning of the year. And sometimes it can fluctuate greatly, sometimes it doesn't at all. But you just want to make sure that whatever you're giving as your initial number, as your income, is something that is going to be as close to real as possible. And if it needs to change, that you make sure that you change it. Now we are ready for some questions.
Thanks so much for sharing with us, Jennifer. We purposely kept our presentations short so you could ask a lot of questions. I apologize, there's a fire truck going on in my background. Speaking of health crises, start asking your questions.
I have no idea what my income will be in 2021. What are your suggestions as to how to estimate that on the Covered California application?
So what I typically do, because the people that I tend to work with are in the entertainment industry and their incomes fluctuate all the time, I have people look back to the last quarter and look at how that last quarter went and what your financial outlook was, and then multiply that by 4 just to get a starting point. And if it changes, wonderful. If it doesn't, then at least you were pretty close to what it's going to be.
What are the best ways to be like, hey, my tax return is totally wrong and I anticipated the wrong amount, and like, please give me a subsidy?
The one thing is it's really hard to get the subsidy after the fact. It's almost impossible. Now they will come after you if you underreport and they want their money back, but it's almost impossible to get it to where they'll give you money back. So what I have people do is I send out little reminders quarterly to my clients to just say, hey, are you, check your income. Has anything changed? Do you think it's going to be lower than what you projected or higher than what you projected? Because it doesn't feel good when you come to the end of the year and you've made a lot less than you expected, but you paid a high premium that you really couldn't afford. And you know that there's really no way to get that money back. It's unfortunately on the client to kind of keep good records throughout the year as to what they're making. If you figure it out the last quarter of the year, most likely it's too late. It's too late to pay higher premiums to make up for anything if you underestimated, and it's too late to get lower premiums if you estimated too high.
How can you tell which level of benefits you need? Example, would you base it on the amount of visits you have per month?
So when I'm doing a needs assessment for a client, I look at what their overall health is, how often they think they go to the doctor in a calendar year, and then I also look at what they're most comfortable with. So some people are not comfortable with the idea that they will have to pay the full price of a visit if they go to the doctor. In that case, if that's not something that you're comfortable with, then the bronze plan is not going to be an option for you. But any level above bronze, silver, gold, platinum, all of those plans, when it comes to outpatient services, anything that you do outside of a hospitalization, you will just have a copay. So it's a lot easier for someone to wrap their mind around just having a copay than being responsible for possibly a $600 bill from a specialist.
Do you have a perspective on determining how much deductible to bear versus a higher monthly premium?
So the one thing that I personally never do unless a client begs me is I never sell the platinum plan, because I look at premium and I multiply that times 12, and then I add the out-of-pocket maximum. And that is truly your financial risk. When you multiply your premiums for the year and then you add in that out-of-pocket maximum for the year, that is your worst case scenario. That is if something catastrophic happened to you, and because you'll have to keep the plan the whole year, that is what you would be responsible for. And can you afford that? The only plans that have deductibles in the Affordable Care Act or in Covered California are the bronze and silver. And again, on the silver plan, you're only paying towards that deductible for a surgery or hospitalization. You're not paying towards that deductible for everyday services. So in most cases, a silver plan is going to be the most financially beneficial for people because they kind of get the best of both worlds for the kinds of needs that people have.
Can you give us any perspective on what might happen to the Covered California marketplace if the ACA is declared unconstitutional?
That's a big question. So first, I want everyone to remain calm and know that There's a lot of provisions in the state of California that have already been passed. A lot of the Affordable Care Act, at least pieces of the Affordable Care Act, like guaranteed issue for pre-existing conditions, and people can't be rated differently based on what sex they were born as. Things of that nature can no longer happen in the state of California, even if the Affordable Care Act is dismantled on the federal level. I also want to make sure that people are honest with themselves and know that it may be a bumpy road to what California can really do, because if the Affordable Care Act is deemed unconstitutional and they take away federal subsidies, then it would be up to the individual states like California to fill in those financial gaps. And I'm not really sure that California is prepared financially to do that.
I've been unemployed for most of 2020, and the amount of unemployment has fluctuated because of the changing amounts of additional pandemic assistance. I did not update my income until a couple weeks ago, and it turned out I've made more than I estimated, and now for November and December I don't get any subsidy, even though the total income amount should qualify me. Any idea why?
So Covered California made some interesting changes this year with the way that they calculated income. And they have made it so that if you change your income later in the year, then what it's trying to do is catch you up financially to what you should have paid the entire year. And especially towards the end, the latter part of this year, if your income is a lot different, it's trying to get you almost like in a neutral position so that when you file your taxes, you're not owing anything, which is why it's so much more. An interesting thing is that the pandemic assistance is not looked at when it comes to Medicaid or Medi-Cal, just regular unemployment is, but it is considered income for Covered California. So it's actually causing a lot of problems for a lot of people. You're not the only one dealing with this. It's a huge issue. And unfortunately, for some people, they didn't even know they had to report that income until more recently, because Covered California was also confused about the rules around that pandemic assistance. So I'm really not sure if it is too high for you to pay, then you should contact either I'm happy to help you. You can reach out to us, or you can reach out to Covered California directly and just see how to figure it out where it's more feasible.
Can you get a little bit more specific about what is in each plan, the major differences between different providers for bronze, silver, and gold? Are there major differences in those different tiers?
So every bronze plan is identical to every bronze plan. The difference is the insurance company and the network of doctors and hospitals that you have available to yourself. If you're wanting to know what the differences are between the tiers themselves, if you think about it the way that it's written, which is these metallic plans, the bronze is going to be the least expensive because you're going to have the first dollar out. You have a high deductible. Silver gives you a little bit of everything. It has a deductible, but all of your outpatient services are just a copay. And then gold and platinum are the richest in benefit plan. You pay a lot more for them, but you have no deductible to worry about if something catastrophic were to happen.
Jennifer, thanks so much for
Thank you.
that.